Okay, welcome back. This is Dr. David Cruz for Whitecoat Medicine Talks, and we're here to talk about the silent killer. In medicine, we call that hypertension or high blood pressure. Now, why do we call it the silent killer? Many people don't know they have the high blood pressure, and once they know that their blood pressure is high, then we can start treating it. But many times there's no symptoms at all. Some people will complain of headaches, blurry vision, headaches, fatigue, chest pain, but many people don't feel it at all. Sometimes we get patients come in with blood pressures 200 over 100 when the normal is 120 over 80, maybe maximum of 140 over 90, and it's that high for them and they don't even feel it. Now, you're not going to feel it until you get a heart attack or you get a stroke, and then you'll know that that is why we call it the silent killer. It's very, very important to get your blood pressure checked and get it treated. I know in the city of Laredo we have different programs where people can just check their blood pressure at different machines. They get points for it. I think in your business you can possibly set it up so that patients do check their blood pressure. I think it's very important that they get checked somewhere, because if they don't have a machine at home, they may not be checking their blood pressure at all if they don't see the doctor. So having maybe something at their business, at your business, to check blood pressure would be a good idea. That way people can be aware of how they're doing with their blood pressure. So many people come in with a slightly elevated blood pressure and they don't want to treat that. It's very important to treat it, because any elevation of your blood pressure is going to cause more pressure on your heart, on your arteries, in your brain, in your eyes, your organs, and so you're going to be damaging your internal organs. Even though you do not feel bad, your internal organs are getting damaged by this high blood pressure. Once you start treating that, things tend to reverse if you catch it early and you don't damage your organs as bad. And so it's very important to make sure that you're monitoring your blood pressure, and when you do find it to be high, definitely get treated. Don't have any resistance towards it. A lot of people want to say, oh, it's because I was exercising, or I was nervous, or I was rushing to get here, and that's why it's high. But if it's consistently high, and if you check yourself at home and it's high, then it's probably time to get treated for that. So what are the main treatments other than not taking medication? Your diet. Make sure your diet's well controlled, less salt intake. Exercise is very important as well. However, if your blood pressure is very high, check with your doctor, because your high blood pressure being already high and then exercising on top of that may lead you to have a heart attack or a stroke or an aneurysm or anything else that can happen when your blood pressure is high. So check with your doctor before starting any type of program. Hypertension is definitely a silent killer. In order for it not to be a silent killer, you need to be checking your blood pressure and letting us know when it is high, and we can start treating it. Definitely get your yearly exams done. Now, let's talk about different patients. We do have a lot of DOT drivers, and a lot of drivers come in once a year or every 2 years for their physical exams, and when we check their blood pressure and it's high, they may tell us sometimes, oh, they didn't know it was high, but a lot of times they do know it's high, they just don't treat themselves. It's really, really important to treat yourself. Now, if you're a DOT driver in this sense, now I'm going to do some videos later on DOT drivers and rules and regulations, which I think is very important, because they are always changing, and the guidelines are there for a reason. We want safety on our roads. But going back to blood pressure, your blood pressure needs to be under 140 over 90. If not, you're not allowed to drive. And there's very good reasons for that, because we do worry about drivers getting strokes, heart attacks while you're on the road, causing other people to get injured or death. And so for people that have these type of jobs, very important to get checked often, check with your doctor, and always stay on top of these things. And once they start treatment, stay on your treatment, because if you're going off your treatment, that's a problem, and they may not want to give you another certification if you do stop taking your medications. We do have patients that are very anxious and their blood pressures tend to go up a little bit. When you go to your doctor and your blood pressure is a little high, make sure that you relax there for a while, maybe see the doctor, and then after that get your blood pressure checked again and see where it's at. After you're sitting down for about 5 minutes and relaxing, a lot of times your blood pressure comes down to where it should be, and if it's normal, then we know that we don't necessarily have to treat that blood pressure. A lot of times we may want to treat it because we do not want you to be in a position where you're anxious or nervous and your blood pressure goes that high, and we want to control your pulse and your blood pressure as well. Overall, hypertension is a silent killer, and we have to be on top of this so that we can avoid you getting sick, you getting heart attacks, you getting strokes, you getting hospitalized for things that you shouldn't have to be hospitalized. It will also cut down in emergency room visits because of feeling bad because your blood pressure is so high. So take your medicines, see your doctor, and this is Dr. David Cruz for Whitecoat Medicine Talks, and we will talk to you next time.